Welcome back. Whether it's a routine blood draw or an upcoming surgery, kids can be scared by medical procedures. Essentia Health offers the region's only child life specialists who make it their job to help kids during appointments or in the hospital. We're joined now by JoHannah Orman, one of Essentia's child life specialists, and thank you very much for joining us tonight.
Thanks for having me.
So when did Essentia Health start offering this service?
The first child life specialist started at Essentia in 2005. And the program has grown, and there's now 2 child life specialists that are providing care for kids in the hospital and in the clinic setting.
Tell us more about what a child life specialist does.
Child life specialists are trained to help kids and families cope with healthcare experiences. That usually involves preparing kids for tests, procedures, anything that can be happening in a healthcare environment. We also support kids through with distraction techniques and coping techniques through anything that they might experience at the hospital. And we're also there to help support normal growth and development. So that may look like some structured play activities or consulting with a parent about a development issue.
Now, some of these children are there for lengthy time periods, and I would imagine that this really helps to follow them from start to finish.
Absolutely. Child life grew out of research that showed that children who were prepared for experiences that they were going to have coped much better. They required less pain medications, they had less psychological upset, they had shorter hospital stays and recovered more quickly from any type of hospital experience.
That's the hospital setting, but what about children who go in for a doctor's appointment?
They also are offered the services of a child life specialist. A lot of what I can provide in the clinic is preparing kids, again, for regular routine immunizations, preparing kids to have surgery or procedures that are scheduled prior to coming to the doctor's office, and also supporting kids. Some kids are scared or nervous about coming to the doctor's office in general, and so we can help provide opportunities for kids to learn and cope through those experiences.
Now, is there a certain age range when you're speaking of children?
We generally serve patients ages birth to 18. There occasionally are times that we see patients a little older than that, but generally birth to 18.
And what's the benefit for kids to have access to your service?
You know, we are safe people, and we're there to focus directly on the child and to advocate for that child. It's a stressful place to be. Clinics and hospitals can be stressful for a child, can be stressful for a parent, and we can be kind of a mediating force in that system to help kids cope and to assess their needs and to help advocate for them.
Now, you mentioned parents. What type of feedback are you getting?
The feedback's overwhelmingly positive. Parents are very excited that we have this service. Parents are very appreciative of the service, especially when they're able to see a difference made in their child who's more comfortable or less anxious or fearful.
Give me an example of how your services have worked.
There's lots of examples. Some of the times when kids are coming, a lot of what we can help do is assess what the situation is and what might help a child cope best. There was a specific situation where a child was struggling in the doctor's office and he preferred the elevator. And so we were able to conduct an exam in a private elevator for that child, which we were able to advocate for him and help him be most comfortable, which in turn helped the doctor complete the exam.
That had to be one of the more unusual places for a checkup.
Absolutely, but the beauty of that, it was conducted with the child's level of comfort in mind, and it helped him immensely to have it done there.
By including child life specialists as part of the caregiving team for the children, what does that say about Essentia Health's commitment to this program?
It says that they're committed to helping our youngest patients. Having a child life program helps not only the child but also the family, and it speaks to the level of care we want to provide for our young patients, and that we prioritize their comfort and their coping as the child and as the whole family.
Now, how can parents request this sort of help?
They can request a child life specialist when they make an appointment, or if they also are in a situation where they feel a child life specialist would be helpful, they can ask to have us paged.
All right. And do you feel fortunate to have such a job? Is it pretty rewarding?
It's very rewarding. I feel very blessed to have a job that I love and that I'm able to help kids be successful and cope well with things that can be really stressful.
Well, thank you very much, JoHannah, for joining us today.
Thank you.